Hi, let me introduce myself. I'm a pediatrician working in Madrid, and what I'm gonna be talking to you is about a conclusion that I have reached after a few weeks of studying this disease. And the conclusion goes as follows. Asthma may be the key to prevent and treat SARS-CoV-19. So in the next few slides, I'm going to try to convince you about that. First of all, let's take a look at the culprit here. This is the virus that produces the disease, and it looks pretty innocent to me, actually. Especially if we consider that a very close cousin of it is the cause of the common cold that we all suffer during the winter. And we all probably have antibodies against this virus, actually. So what is that so special about this virus? This is because this virus produces SARS, and SARS stands for severe acute respiratory syndrome. So in the next couple of slides, I'm gonna try to explain to you what is SARS in a very simple way. So we have here the respiratory system whereby air containing oxygen gets into the bronchi and finally into the alveoli. And within the alveoli is where gas exchange takes place and oxygen gets into the blood and oxygenates hemoglobin, and we get rid at the same time of CO2. And in this alveoli, there is something else that takes place and is very important. And this is the fight against bugs, viruses, bacteria, and so on. And this fight is led by the inflammatory immune cells that do this job actually on a daily basis very efficiently. What happens during the SARS is that something goes very wrong with this defense mechanism. And actually the cells that are in charge of getting rid of the bugs get nuts, literally, and starts producing lots of inflammatory molecules. And some of the consequences of this is that besides lung injury, is that fluid from the blood gets into the alveoli, and this is pretty bad actually, because what happens next is that oxygen that comes here cannot go through this liquid and cannot oxygenate blood. So when the virus encounters a person not at risk, it produces a disease that is very similar to the influenza, probably a little bit worse and more protracted. Actually, the disease lasts in average 2, 3, or even 4 weeks. But people recover after that normally. So we can represent this in a graphic way. With this graphic here, we have the peak of the symptoms and then the recovery time. When the virus encounters, however, person at risk, it also produces a flu-like disease that eventually, in most of the cases, recovers without any consequence. But in some of the cases, what occurs is what we call a self-inflammatory phenomenon. That is the beginning of the development of SARS. And people who develop this self-inflammatory phenomenon reaction end up in the ICU on a ventilator. So again, to represent this graphically, this is the flu-like symptoms, and this is the SARS that usually starts when the people start recovering from the flu-like symptoms. So at this point, if people start feeling dyspnea out of nowhere, and difficulty breathing, then we have to be very alert because something wrong is happening, and it's probably SARS. So to conclude, to summarize what we say so far is SARS is not an infection, but a complication of a viral infection, right? In fact, it's an inflammatory disease. We can define it as such. And once SARS is triggered, the CoV-2 viral infection is not relevant anymore. In fact, during SARS, we don't, in most of the cases, we are not able to isolate virus. So the macrophages and so on have been very efficient in eliminating the virus, but they have created a true bomb, actually. To summarize again, 90% of COVID-infected people have only more or less a bad flu. So who are the people who are at risk of developing SARS? The elderly, people with high blood pressure, people with diabetes, and people with cardiovascular diseases. So just to remind you again what looks like, and this is, I think, it's very important that we keep in mind how it works, the disease, through this graphic representation. So although we know pretty much already what are the, let's say, the biggest risk factor for having SARS, there is a lot of confusion actually around this. And this is news from last week actually that ask, are people with asthma more at risk of COVID-19? And so we are going to try to answer this question. First of all, let's take a look at the already many series of severe patients that have been published so far. So this is the first one from Wuhan, 155 patients, and you see that there is a common pattern of risk factors that we have mentioned already. There is something, however, that is striking. In this series, at least, there is no mention of asthma patients. In the next series, there is almost the same pattern with some differences, and again, no asthma patients. Okay? Another series, the same thing, no asthma patient. And this last one is an Italy series of 3,200 dead patients. And you see some differences actually here that we start seeing the presence of cancer people having the SARS, and also COPD, which is stands for chronic obstructive pulmonary disease, not to be confused with asthma. Chronic obstructive pulmonary disease is a disease of the elderly who are on cigarettes actually. And so now we have to look to compare, just to give value to these studies, we have to compare them with the general prevalence of these diseases in the general population, okay? And we see that actually cardiovascular diseases and diabetes and, well, cancer not so, and also not so, but these two diseases are overly represented in the patients group, okay? And finally, what is striking is that asthma, which has a prevalence of around 10% in the general population, don't have a representation in all these series, okay? So to end this study, I'm going to show you a last series of severe patients from Wuhan again. And what is interesting about this study is that this has been done by departments of allergology who are looking very specifically at asthma patients in this a group of 150 patients. And what they found is zero, no asthma patients in this group. So we can reach our provisional conclusion. Asthma seems to be a protective factor for having SARS, COVID-19. So what is protected about asthma? So we can ask this question, is it having asthma itself? So people who have asthma is protected against this horrible disease? Or is being on asthma medication? Because most of the people with asthma, especially chronic elder people with asthma, are on asthma medication. Or both. I personally prefer this, but it can be both actually, possibility. So let's take a look at two facts that we have recalled so far. The first one is that a considerable proportion of the population, 5 to 10%, are on chronic anti-asthmatic medication and seems to be protected against the severe complications of COVID-19. So, what is the chronic treatment of asthma? It's constantly consists of two kinds of drugs, inhaled corticosteroids and long-acting beta-adrenergic agonists. Those two drugs have been around for decades and have been tested thoroughly, are very safe medications, and also very importantly, both of them are strong anti-inflammatory drugs, which is very important for the last conclusion that I'm going to show you here. So what I propose, both to the colleagues, my colleagues, general professionals in general, and health authorities, is the following. Provisionally, to start treating patients at risk, as I show here, with starting having symptoms or with a positive COVID-19 test. But eventually this strategy that I'm going to show you could be used in the whole population of suspected COVID-infected people. So what I propose is that just when these people at risk start having symptoms of the common flu part of the disease, not when they start having SARS. This is probably too late to start this medication. So we have to start here. This is the key point to start the medication, okay? What I propose is to begin aggressive treatment with inhaled corticosteroids plus LABA, which are the long-acting beta agonists. And we should continue this treatment for at least a month, just to be sure that nothing here happens. So thank you very much for your attention.